Today, New Jersey's opioid crisis. Drug deaths in the state hit another record in 2018, largely due to the opioid epidemic. And with millions of dollars pledged to stop the problem and the use of Narcan that prevented even more deaths, many are wondering, why is it getting worse? But there may be a light at the end of this very dark tunnel. Data shows the percentages of deaths may be slowing. And with the increased level of awareness to date, perhaps we've reached the point where the tide can make a long-awaited turn. Today, we hear from the experts. Angelo Valente, Executive Director of the Partnership for a Drug-Free New Jersey. FISCHER-KASLANDER, Executive Director of Passaic County Court-Appointed Special Advocates. Dr. Lewis Nelson of Rutgers, New Jersey Medical School, and Sheriff James Gannon of Morris County. It's all ahead on New Jersey Now. Good afternoon, I'm Diane Doctor, and welcome to New Jersey Now. Today we have a great panel to talk about a serious topic in New Jersey, the crisis of opioid addiction and deaths that have resulted from it. Despite all the intervention, despite what you've heard, despite what you've read, the problem is getting worse. Last year in New Jersey, approximately 3,000 people died of drug overdoses due to opioid addiction or directly related to opioids. That is more than the number of people killed by the flu, homicides, car accidents, suicides, all combined. So lest you think this is not a serious problem, it is. And the people here today, all involved to a certain extent. I'm going to start with Sheriff Gannon. Just give us an overview. How has this problem increased? What are you seeing day to day on the streets?
Yeah, I'm seeing it at ground level. I'm seeing over the last 3 decades ever-increasing numbers of fatalities when it comes to addiction. I mean, right now we're seeing opioid addiction at numbers that we could never have imagined before. And it's overdose, it's fatal overdose, but it's also the breakdown of these families. Everybody's impacted. This has nothing to do with sex, has nothing to do with race or socioeconomics or voting district. This is impacting everyone. I would suggest that everyone around their Thanksgiving dinner table has a story. It may not be a family member, but it's a colleague, it's a friend, someone that's been impacted by this epidemic.
Well, I'm going to go to Erica, whose job is to oversee these children that are displaced by this issue, and this has just gotten to become a crisis in Passaic County, correct?
Absolutely. Yeah, our organization advocates for children who've entered foster care, and specifically over the last several years, as the sheriff mentioned, that number has significantly risen due to the substance abuse and the opioids more specifically. And our organization recruits and trains volunteers who are appointed by family court judges to really speak up for children who've entered the foster care system. But in Passaic County, the numbers of children entering due to their parents' opioid addictions and even subsequent death in many cases have just skyrocketed. And it really is in a position that because of these numbers, we're seeing the trend going towards really a crisis that the system is unable to handle.
And this isn't an urban problem, a suburban problem. This is everywhere, correct?
There's no question about that. There's not a community, a neighborhood in the state of New Jersey that hasn't been impacted by the opiate epidemic. And the only way we're going to be able to see any change is through education. So it's so important, programs like this, sharing information, letting people know the steps and how important it is to look at opiate alternatives when they're being prescribed an opiate for the first time, looking at ways to be able to identify signs and symptoms of addiction so that if a family member is showing those signs and symptoms, that you immediately get access to treatment. So I think those are the kind of steps we need to take as a state and as a country in order to really turn this epidemic that's been impacting thousands and thousands of families in the state of New Jersey. And I think part of the problem is the fact that there has been overprescribing of opiates. We know that, for example, if someone is prescribed an opiate for 7 days and is on an opiate for 7 days, they have a 1 in 7 chance of becoming dependent and addicted to opiates within 1 year. If they're prescribed and take an opiate for 30 days, that number goes to 1 in 3. So I think part of it has to be looking at the way we prescribe, looking at safe prescribing, and look at alternatives to opiates.
Doctor, are you seeing that more physicians are reluctant to prescribe opiates because of this, or is there no check on it?
I think it's a mixed bag. I think there's a lot of pressures on healthcare providers to do what's best for their patient. But even those decisions are complicated by regulations and guidelines and expectations that are sometimes very difficult to meet. It is true, and I agree with Angelo very much, that the epidemic that we're seeing had its roots in the healthcare system. I mean, remember, heroin use has been going on for 50 years, but the real change occurred in the 80s when we started to see a liberalization of opioid use for medicinal reasons. And as suggested, the more you give and the larger the duration of prescribing, the more likely you are to develop opioid dependence, which means you can't stop using the drug because you develop opioid withdrawal. And in corollary to that is addiction and abuse and worsening pain, which we call hyperalgesia. So those things really do happen. Though the epidemic itself is dynamic, and it has changed in some of the problems we see now with the rise of heroin and fentanyl, which in some part are related to the overuse of prescription opioids. They're an outlet valve for people who can no longer get their prescriptions because doctors have been a little reluctant to prescribe. But I don't think we're reluctant to prescribe to people that need them. I think we've recognized what the bounds of normal use is. But this new epidemic, which is in part related to the prescription epidemic of opioid use, in and of itself also has roots de novo in use of heroin and fentanyl. So it's sort of a double epidemic that we're seeing at this point.
So you're saying that by clamping down on one, you've kind of sent the traffic to the other two?
To some extent, unquestionably, we've moved some patients who would use prescription opioids over to use these other agents. But because of the reduced price and the increased availability of heroin and now fentanyl and its derivatives, they're much more readily available and much more cost-effective than getting a prescription opioid. Even if the prescription opioid didn't come from a doctor and you bought it on the street, it's still very expensive compared to the price you pay for heroin or fentanyl.
Sheriff, how do you police against this? How do you stop it?
Yeah, I think it's a three-part issue. I think education, as Angelo said, we're here to educate people. We're in the community to educate people. I think there's a big treatment component that we need to deal with, but I think we need to be clear. Enforcement and interdiction of the for-profit opioid dealer and the organization needs to be a primary concern of government, a primary concern of law enforcement. I've deployed resources on different cases to the federal authorities, the state authorities, and our county, in Morris County, to defeat that. But we need to focus on that. The simple user, obviously, we need treatment for that person because we're not going to arrest our way out of it. We're not going to incarcerate our way out of it. But I think we need very, very strong enforcement, and I think we need monies to do those things.
And how are children impacted? Give us a case study of what happens.
I mean, obviously, our number one concern is always for the safety of children that are in the home with somebody who has any type of substance abuse, but specifically, opioids, because of the severity of most addictions of that type. Our children that enter the foster care system are, the most impacted because at that point, it's risen to the level that, the family has, brought to the attention of the system. Unfortunately, there's so many children that are in homes of parents with addiction that the greater society, their family and friends are unaware, and those children are at even greater risk because they don't have services in place, they don't have the support services of treatment the sheriff was mentioning, and those are the children that we really, really have to be most aware of, and we need the community education that we've been talking about to reach them. So the education is key because the children that are, in these homes, in our school system, there are next door neighbors across the county. It's not just an urban problem, which is, a number one myth, in our area. They're at risk when they go home every day from school. They're at risk all weekend when they're home alone with parents with an addiction issue and they're, left to fend for themselves, to feed themselves, to cook for themselves, to, put their younger siblings to bed. We recently had a case of a mother, and she had an infant and a toddler who was found passed away, unfortunately, in the woods near her home. She had the baby strapped to her chest in an infant carrier, and the toddler was in a stroller. Thank goodness there was, another neighbor who had gone out for a walk with their dog and heard the children crying. And this mother had died from an overdose. while she was out walking with her children. Those children are now safe in the foster care system, but unfortunately these are things that happen every day, and this was a very safe neighborhood. This was a middle-class family. This wasn't an urban area, and these are happening every day. We have multiple children entering foster care in Passaic County every day because of substance abuse issues.
And what I'm hearing is the resources aren't there. Your private organizations are stepping in where the state and the federal government have not really filled the void.
Well, I think that there's been a spirit of cooperation across all levels of government and certainly in the communities of law enforcement, prevention and treatment to come up with solutions, because as was mentioned, this is an issue that's affecting everyone. And I think one of the other areas that we have seen a lot of support for is breaking down the stigma that comes along with this particular disease, because it is a disease. And one thing that we're realizing is that everyone is susceptible to potentially having a family member who might be, or themselves, who might be in that situation. So being able to share those stories, being able to educate people about steps they can take to help protect themselves and their families is crucial if we're going to be able to see change.
Why not restrict these drugs to anyone except the most needy?
There have been steps. For example, in the state of New Jersey, there's a 5-day limit on prescribing for the first time to a patient. The other thing that's unique in New Jersey, which was really, we think, a game changer, was now it's required that a physician or dentist or whoever's prescribing, a nurse practitioner, has to share information with the patient or the parent of patients about the addictive quality of the drug and also about potential non-opiate alternatives that might be available. When we think about opiate prescribing, we've learned that dentists, for example, are the #1 prescriber of opiates to children between the ages of 13 and 17. And that's because of a wisdom tooth extractions, which are very common at that age. So this is an area that's really impacting everyone and every discipline within the medical community.
Okay, it's a great discussion, and when we come back, we'll talk about some solutions to the continuing opioid crisis. What are they, and are new approaches needed to stem the problem? Stay tuned. Welcome back to New Jersey Now. We're talking about the opioid crisis in New Jersey, and we've got a great panel of experts. This particular issue, there has been some discussion in New Jersey of addressing with medical marijuana, using one to offset the other. I'm going to start with the sheriff and get the law enforcement point of view on this. How smart is it to use medical marijuana for opioid addicts?
Let me qualify my response by saying I'm not highly qualified in that area, but something about it does not ring right to me. I've been in this business for decades. One thing I know in talking to the addiction community is no one thinks that using marijuana for the opioid problem is a good thing from the addiction community. And that's where I live many times. So I'm not too happy with that, to be perfectly candid with you. If we can use it for medical purpose, other medical purpose, I think that's wonderful. I think that's wonderful. That's what we should be doing with substances, that can help people along that are sick and things like that. That's what we should be doing in a society like ours, but I'm concerned as we go down the lane here.
I think you're concerned too.
Well, I think we need to incorporate treatment as a major component of any development of alternatives to opiates, because if a person is opiate dependent, they need to get access to treatment, and whatever they're going to substitute an opiate for, I don't think is really the solution. I mean, maybe it's a bridge or a gap, but they certainly need to be able to provide access to comprehensive treatment as part of that movement.
Is there enough of that available for these thousands and thousands of people who've become addicted?
I think there's always need for additional resources in treatment. I think we have to get to a point where people believe they need to get treatment, or that there is encouragement for an individual to seek treatment. So I think that's another barrier. It's not only the access or the treatment that exists, but it's also getting somebody motivated or being in a position to be able to get access to that treatment as well.
And from a family point of view, is it wise to introduce another drug into a family, obviously, where there's drug addiction? Marijuana is still a drug, even if it becomes legal.
I have concerns similar to what the sheriff mentioned. I think treatment as a holistic basis is really what's necessary. We don't want to replace one drug with another, and I think it's too new of even a concept. We're just learning about this proposal this week. But from the family court perspective, from a therapeutic perspective, we're thinking about what's best for our children at first and foremost. And one substance is not necessarily any better than another.
How does the marijuana help someone who is opioid addicted? Is it really substituting one for another? Is it some type of panacea? How does it work?
There are no data to support its use in this role. I mean, there are virtually no data to support its use for anything. And like a lot of things, if you have a perspective, you could cherry pick the literature to show whatever you want to show. The one thing I'd feel comfortable saying is that if we could replace opioids with marijuana, we'd probably be in a better place. Right? I mean, it's pretty hard to die from a marijuana overdose. Anything's possible, but we certainly wouldn't see the 40,000 plus.
And is it possible to substitute one for the other that way?
No. I mean, unless we banned opioids and only sold marijuana, cannabis. I mean, I don't think that's possible. So I think what we're going to see is the addition of cannabis onto people who have chronic opioid use. And of course, combining two drugs is never safer than using any drug in and of itself. And we know how unsafe opioids are per se. So I don't really see this being a logical approach to solving the opioid crisis, honestly.
Outside of treatment, what other suggestions do you have?
Treatment, see, it is a holy grail. I mean, to find something that actually treats opioid dependence, to find something that treats almost any addiction is so complicated. Remember, the addiction really, it hijacks your neurochemistry. It hijacks the way your brain functions, so that you're really continually either seeking the pleasurable effects of the drug, or you're preventing the non-pleasurable effects of the drug by putting a drug back on there. So people who have addiction often have addiction to a lot of different things, because there's sort of a crossover between a lot of these addictive substances, in addition to non-drug related addictions, whether it's gambling or or whatever it might be.
I was going to talk about that. We haven't really talked about the societal factors that contribute here. We've talked about somebody being prescribed these drugs by a doctor and becoming hooked on them.
But just to talk about the treatment idea, the holy grail has been to try to find something that is able to blunt the addiction and the craving and the pursuit of drug that's associated with drug use. The thing that we have that probably works best for opioids, and it probably, believe it or not, is one of the more treatable addictions that we have, is a drug like buprenorphine, or methadone to some extent. There are a lot of resources out there to try to increase the availability of these drugs. But as has been commented, it's a difficult patient population. There's a lot of stigma associated with the disease. A lot of healthcare providers don't really want to access this population and provide care, which really squeezes the resources pretty tightly and makes it very hard to access. But drugs like buprenorphine, which is called Suboxone, are fairly effective if we can get the patient and the patient's support system to be able to access these care resources.
Has the administration done enough just to get the word out? I mean, we saw the Chris Christie commercials. We haven't really heard or seen much until recently from the Murphy administration. Do you want to speak to that?
We're certainly pleased that the administration had a full package of plans in place to be able to address the issue. I think that we're certainly, the nonprofit community, law enforcement, treatment and prevention have continuously been working to get messages out to the residents of New Jersey about ways to be able to help safeguard themselves and their families, as well as breaking down that stigma to be able to access treatment. So I think there's been a consistent approach on the part of those people that have been involved in this issue, and certainly the governor and his administration just recently announced the whole package of plans that they want to put in place. So it's a step in the right direction.
Okay. Thank you all for being with us, and we'll continue on this subject in just a minute. Next, another side of the epidemic. Moms and moms-to-be struggling with opioids. One OBGYN has the scary facts about this ongoing issue when we return. Stay tuned. with Dr. Cassandra Hicks-Autry, who is a board-certified obstetrician gynecologist with W2W Physicians. That's out of Freehold, New Jersey. Doctor, thank you for joining us on New Jersey Now. We're talking about something that many people are not aware of, and that is how opioid addiction affects babies, newborn babies. And this is a result of more and more moms who are addicted to opioids, who some of them aren't even disclosing it to you.
Right.
Tell me about the scope of this problem.
It is a large problem. All over the United States, there has been an increase in the use of opioids in the general population. Of particular concern to me is the obstetrical patient who comes in with an unborn child, and if they're using opioids, that exposure can cause significant stress to that pregnancy and that unborn child.
So what steps do you take to find out if the mom is addicted to opioids, if she's not disclosing it to you?
So on the initial visit that patient has with us, we have a screening method, and we ask specific questions that would engage that conversation. So we're looking for any type of drug use, opioids included, but also alcohol use or cigarette use. We try to get the patient to disclose that information because it is important. During the course of the pregnancy, we observe their visits to prenatal care. How often are they coming? Are they missing too many? Are there any signs or symptoms that something may be going on that may make us think that this patient may have a drug addicted problem?
So what happens when you discover that the pregnant mom is addicted to opioids? What do you do? What's the intervention?
Extensive counseling. One, we do not want to shame that patient or make them feel as though they should be embarrassed about their addiction, because that can force them to not come to care. So we want to give them the social support that they need, counseling, and it is very important that that patient does not immediately stop the use of their opioid, whether that is heroin or if it's a prescription drug that they're taking in excess. They need to have that medical support to switch over to other medications like methadone and Suboxone that could be a lot more, decrease the chances of fetal and neonatal complications.
And what happens if they stop? I mean, most people would say, why not just take them off of it immediately?
Well, it's been found that those patients who stopped abruptly, they are more likely to relapse, and that can increase their chances of having a personal overdose. Also, for the fetus, that abrupt disruption of that opioid dependency can cause significant problems, including fetal demise. So we strongly discourage patients, as oddly as it may sound, to abruptly stop the use of opioids during pregnancy.
So let's say the mom gets all the way through the pregnancy and is addicted, and it's not detected till the end, so the baby is then born addicted?
Yes. Unfortunately, about 50% of babies born to opioid addicted moms will have neonatal opioid withdrawal syndrome.
Wow.
Yes. Those symptoms are noted usually within the first 24 to 48 hours after delivery, but you can pick them up as late as 5 to 10 days after withdrawal symptoms.
And what long-term impact does this have on the children?
Well, long-term, there could be a variety of different concerns that have to be focused on, and the pediatrician will look for those particular things, but developmental and educational delays are often seen in these patients.
And I just want to reiterate, this isn't an urban problem, this isn't a suburban problem, this is a problem that just spans almost every person, every lifestyle, and cuts across all different classes, distinctions, ethnicities. It's everywhere.
Absolutely. We used to think of it as an urban problem, but it's certainly in suburbia now. Socioeconomic classes, every one of them have been affected by this opioid crisis that is here in America today.
Well, Doctor, thank you for coming on today, and thank you for joining us for this edition of New Jersey Now. I'm Diane Doctor. Have a great day.